Hello, everyone who's listening to this recording now for SOC301 Social Problems. We are blessed today to be joined by Ayotunde Ikiku, activist, artist, visionary. I'm trying to think all the other titles I can throw at you, but we are privileged today to have someone who's been on the front lines of very important activist organizing and change making in the Sacramento region. A major voice in a lot of social movements that affect people's lives. So, with Ayotunde works with and works for, helps lead the Gender Health Center in Sacramento. So with that, I would like to just open up Ayotunde to, from your perspective, can you break down the history of the Gender Health Center, or GHC, and what they do and what they have done in the past?
Yes. So essentially, the Gender Health Center, which is GHC, we are a nonprofit organization that focuses on the healthcare disparities that are faced by the transgender and queer community specifically. And so our services are centered around alleviating those disparities. And so that looks like mental health services when it comes to counseling or just general healthcare enrollment for folks. We also have a hormone clinic. We have harm reduction services for folks who may need needles or healthy sex tools such as condoms or lubricant. We also offer binders for folks who may need binding for their bodies. So just a plethora of various services. We have a needle exchange for folks who are either needing safe and clean needles for use of whatever requires needles, whether that's their hormones or safe drug practices. Trying to think. I don't know. We do a lot of things. It's like a whole buffet of things that we try to offer community, and a lot of our work is centered around a combination of direct service and activism and community work. And so we do have our services that are things like counseling and healthcare enrollment, name and gender changes, stuff like that. But we also are involved with direct community when it comes to legislation or different movements that affect our community out on the streets, and make sure that we have a presence there as well.
I feel like a lot of groups. Sorry, I feel like a lot of groups do that mixture of helping folks here today, right? The folks who are in need today, but they blend that, what I think of as like triage work, with the more kind of like bigger fish, upstream advocacy in terms of policy change, right? The example that comes to my mind, or comes up a lot in class, are like groups that do work on like housing insecurity. They might also have like a food pantry or some food distribution or like a clothing distribution. But I imagine that those services, those groups would love to never have to do those services, right? So they do this like upstream work to try to prevent that. Can you think of some examples of recent successes or challenges that the GHC has faced in terms of changing policy?
I would say a lot of the challenge just comes from ignorance, whether that's willful ignorance or just simply someone just not knowing something, and not necessarily having the drive or motivation to look for it. And so when it comes to, the life experience of being someone that's transgender, and someone who is not trans, or someone who would be cisgender, if you don't have anyone that's trans in your direct circle and your family, you oftentimes aren't aware of that. And so that's reflective of the folks who have the authority to make these laws. The same thing works for them. And so they don't have anyone in their life who is connected in that way, then that's not going to be in their purview when it comes to advocating for the rights of those people. And so a lot of it comes down to the challenge of visibility And then the importance of making partnerships with people who are willing and open to learning and having humility and being like, you know what, I don't really know much about trans rights or what trans folks need support in, but I'm open to learning. And so can we meet and can we sit down and how can I best support your community? And so having conversations like that is really beneficial. Katie Valenzuela is one person who has been really successful at doing something like that, running for city council for the next round, and just working with kind of like other organizations and kind of getting the word out. It really does come down to visibility and then building those healthy and solid partnerships and relationships with folks who are spread out in the state, who are spread out in the county, who are all part of different institutions. So we're able to create this like network and this like web of support.
I imagine that's got to be a really hard process to navigate, especially when you're reaching out to folks who might not have a personal stake or a firsthand kind of experience with the issues that y'all are fighting for. What are some challenges that you face in building those like alliances, specifically for trans advocacy work? What are some barriers to forming those bridges? Because I imagine that there are plenty of folks who just don't, they're not in a place where they need to be in order to like have like genuine kind of like ally to play that kind of genuine ally or advocate collaborator role with y'all. So what are some barriers that the group or the community in general faces with allyship?
I think one barrier is that there isn't really a blueprint in how to successfully handle this obstacle. And so different people, different institutions, different times require different methods. And so sometimes it looks like something that may be a little bit more passive, like sending out letters of support and asking and just seeing where that goes. And then other times it looks like something a little bit more assertive, something a little bit more direct action oriented, where you're showing up to places and protesting or demanding that voices be heard and that people are using the authority that they already have to benefit the community, of which they're not doing or may not be even aware that they have the power to do so, because that who have a lot more influence than they think they do when it comes to legislation and just any kind of upward mobility or voice that they may have in any institution that they're tied to, and really just using that voice for an underserved community.
So you mentioned some terminology that I unfortunately can't rely on my students for sure being familiar with, in terms of cis versus trans. I know I've heard you give this talk a bunch. So can you, for someone who never has heard these terms before, cis and trans, can you explain what the differences are and what they mean?
Yes. So a cisgender person is someone who was assigned a gender that was based on their sex or genitalia at birth. And that assignment that they received matches up with their gender. And so if you were assigned male, for example, because you had a penis at birth, and when you're able to come into your gender identity and you realize that that is congruent and that is correct, then you're a cisgender. But if you were assigned something and you came into gender identity and you found out that that actually wasn't congruent and that was a misassignment and a misconception that was projected upon you, then you would fall into the transgender umbrella, meaning that you do not fit with the assignment that you were given.
And And I've heard you talk about
that
like
was
the
based on your
diversity
sex.
in that trans umbrella, right? That it's not this like simple, clean, like homogenous category, right?
Right. It's definitely an
Right.
umbrella. I think a lot of
Right. It's definitely an umbrella. I think a lot of people, when they hear the word trans, they instantly think of just trans women. And there are trans women, but there are also trans men. There are people who are non-binary, who don't align with being a man or a woman in any capacity. There are people who don't really identify with any gender at all. They feel that they're agender without gender. And many, many, many more. There's a plethora, a spectrum of different ways people can come into themselves and identify when it comes to their gender identity, which is separate from their sex, which is simply referring to the reproductive organs that you have, which do not really. There's like no absolute in how you are as a person based only on your genitalia. And we know that even sociologically, that it's not a matter of nature or nurture, that it's a combination of both. And we also know that biologically, the gender binary that we have, and when I'm saying gender binary, that's referring to folks who believe that there's only a man or a woman. We already know that that's incorrect on a genetic basis, because there are folks who are intersex. And so there are more options than just these two labels that we like to place on people. And there's also more than a binary when it comes to even genitalia, and the way that genitalia can show up and present itself. There's many, many ways genitalia can pop up, and many ambiguous ways that it can present itself, to where there are people who may be raised and believe that they are cisgender, and through some kind of trial or event in their life discover that they are actually intersex. Because when it comes to being intersex, not only may their genitalia be ambiguous or a combination of genitalia, or just not fitting into the binary, but their internal organs, reproductive organs as well, can be a variety and a different set. One example I can give is like someone can be born with a vulva, vagina, and think that they are a cisgender woman because of that, and because of the assignment that they were given, and possibly not told that they were intersex ever. And I'm kind of referencing a real life story that has happened. And when they try to, maybe they grow up and they have a partner who's cisgender male, and they're trying to have a child, and they can't, because they discover that the person doesn't have ovaries. And so that's just one small example of ways that our bodies are just variant and our minds are variant, and that there often is a conflation between sex and gender that shouldn't be there, because those two are separate things. They can be related, but they are not the same. And gender definitely is something that's more of a social construct. But saying that it's a social construct doesn't mean that it doesn't have its own reality and real world impacts and implications. And I think one of the most important things to just think of is that gender has nothing to do with genitalia. It just can be related to it. And it's more about like your mind and who you are as a being, and for some people and myself, more of a spiritual thing, than it is about something as I don't know, something as trivial as sex. I think a lot of people kind of focus on this like sex aspect a little bit too much when it comes to who people are.
I had the opportunity to listen to Georgianne Davis, who's a sociologist at UNLV, she herself is intersex, and she writes about the intersex experience and the history of intersex people. And she talked about the ways that medical professionals, right, doctors at birth will coerce or sometimes just not even tell the parents that they do this significant gender reassignment surgery, right, with the belief that it's necessary, right, when it's not actually medically necessary, right. When they are presented with a newborn child who presents reproductive organs that don't align with that like binary that you're talking about, that they'll force surgery on the child, right? Yeah, it sounds like such a horrific thing to imagine someone going through, but
yes, genome mutilation is definitely involved,
right, to conform to this this imagined socially constructed category that we all didn't decide on, right? Right. So can you talk more about the advocacy that you do for folks who, in that process, like you mentioned this a couple times, this process of coming into your gender identity, as folks do go through that process, which can happen for folks at a variety of different stages in their life, I imagine. How does GHC slot into that process for people, and what kinds of services do folks come to you for, and what kinds of problems emerge for folks in that process, and how do y'all step in? Because I mean, everyone goes through, like, regardless if you're cis or trans, I imagine there's constantly this coming into your gender identity, right? But it's just for these folks who are trans that process seems to be potentially more like problematic because of this lack of societal understanding, because of the enforcement of policies and practices and social institutions. It makes their process harder, right? So how do y'all step in to make that process easier for them?
I would say that the very first point of contact between us and anyone else is meeting them where they're at. And so for some people, it could be the very beginning of their gender identity journey, or it's just something that they've known for a long time, but were too fearful or just unable to access until they reached us. And so for those folks, again, we kind of meet them where they're at, see how they're feeling about the gender identity, sometimes give them more resources or education around it, because for some people, they may just know that they're not cis, but they don't know what they are, and what that means, and kind of what transitioning means if they are interested in or curious about medically transitioning when it comes to hormones or surgeries and things of that nature. And kind of walking them through that. If that's something that they are interested in, then we make sure that they know how to communicate with their doctor and advocate for their rights and are aware of what their rights are before going in, as well as having our contact and a pathway to get medical legal help if they are discriminated against for any reason or denied services, which is highly likely for our community specifically, and which occurs at a disproportionate rate. So oftentimes throughout any process, there's going to be some kind of discrimination at some point. And so because of that and the nature of the system, we have created or found ways to kind of appeal those instances.
So the medical industry, like as a social institution, seems to be one of those kind of key places where that trauma that trans folks can experience, where that really is exacerbated, right? Can you talk about like some of the more in depth about some of the experiences that folks have in navigating the medical industry, and like what discrimination might look like, both from a systemic and from an interpersonal perspective?
Yeah. Kind of like I was touching on earlier, the people who are giving us these services and the people who have authority over our health are a reflection of society. And so if there is a group such as transgender people who are deemed unworthy at a societal like almost within a societal consensus, then that's going to be present wherever people who are in that society are. And so that means that that's going to be very much present in the medical field. And so when folks are trying to receive services, they may or may not even be out to their provider or the hospital or wherever they're going, because it may or may not be safe to do so. Some folks are also veterans, which tends to be a little bit more conservative and even less accepting of different types of people, not only from a gender standpoint, but also a racial and disability standpoint. And so folks are already coming in traumatized by society, knowing that they're walking into this place where they have absolutely no power and are having to ask, essentially, for services that they need for their own livelihood, and having to be vulnerable in that. And a lot of the times, those folks don't have the trans cultural competency. And because of that, instead of kind of referring to just treating a human being like a human being, people go back to wanting to other folks, even in these places. And so folks are denied the name, possibly, that they are wanting and saying that they are using for themselves, if it's different from what is what their legal name is currently stating at the time of service. Folks can be consistently or even intentionally misgendered, even after expressing what their gender identity is or what their pronouns are to their provider. Folks can be deterred from services and oftentimes given misinformation by providers. One common thing that happens is folks will go see their PCP, which is their primary care provider, who is the person who is supposed to do all of your primary care. So hormones would fall under the primary care category. And so what a lot of folks run into is going to their PCP and requesting that they are interested in starting hormones, which looks like blood work and a prescription, essentially, if everything looks good. Like anyone else, because hormones aren't anything that's exclusive to trans people. It's like going to a doctor for literally anything else. They are there to provide a service and to provide counsel. And so what people run into is doctors saying, well, I don't have trans patients, or I don't know how to work with trans people, or I don't feel comfortable doing this, things of that nature. And sometimes I don't do this, so I'm going to refer you out to someone else. Which at that point, they're supposed to. If your doctor is not able to do a service that you are requesting, then they are legally obligated to at least refer you out to someone that can, especially if they're saying they're not. So they don't really get points for that. Like one issue is that sometimes they will send them to an endocrinologist or like a urologist. I had someone send someone to a gynecologist for some reason. And those providers can do that. But the thing about it is that it's such a simple thing that falls into primary care that there's no reason why a PCP shouldn't be able to do it, and is creating another obstacle for a basic service. Yes, exactly. You don't need to be adding it to a specialist load when it's something that you are already fully trained and know how to do and can do, and are just denying this person because they hear the word trans, and once it's trans, it's like, oh, I don't know, I don't know how to do that, or like, I don't have trans patients, which at that point, it's like, how do you know that you don't have trans patients? And are you tracking that? Like, do you have data for that? Because considering the stats of the trans demographic, we are a small portion, but we're also increasing, and it's just numerically impossible for someone to have no trans patients and no trans family, and honestly, no trans friends. And that's also a reflection of society and people kind of having this assumption that everyone is able-bodied and everyone is straight and everyone is cisgender, and that's just not reflective of
So I think
humanity.
another big part of the medical, the social institution of healthcare, right, is this idea of insurance, right, and the role that insurance and how folks can actually go about affording their healthcare, right. In previous conversations that we've had in lectures that I've heard you give, you talk about the role of insurance, right? This isn't just from like the interpersonal or systemic role of like the healthcare provider, but the system of insurance. Can you talk about how medical insurance affects trans folks?
Insurance is a chaotic mess for all of us, but it's even more chaotic for the trans community, especially for people who fall under intersections of being Black, being brown, being undocumented, even
underemployed,
because being unemployed, especially unemployed, particularly because the pathway to insurance in our country for a lot of people is to be employed in order to get insurance or insurance of any value, or any supposed value, I should say. And so when we look at the statistics of denial when it comes to trans people seeking medical services, we have to look at the disproportionate amount of trans people that are unemployed to begin with, which means that the amount of us that have access to insurance is pretty small, and we're already a small community. And yet, for some reason, 55% of us are denied access to care while having insurance for no reason. And so obviously that's a hugely disproportionate amount. And we also know when it comes to stats that whatever is reported is often underreported. So it's probably way higher than 55%. But that means that pretty much the majority, like every trans person that you talk to with or without insurance is being discriminated against and is still not able to get access, even when they've gotten a job and have paid into their insurance or are paying into their insurance and trying to seek services and are still facing these barriers when they shouldn't be. And when other people aren't facing those same exact barriers, because at least, when you're a cisgender or something like that, you're going to have to deal with the chaotic mess of insurance regardless, but at least things are moving. Like there's a cog that's going. When you're trans, it's kind of like you step in the door and the door shuts on you as soon as you get to it.
Right.
You can't even get in.
The medical necessity of the healthcare that trans folks need. What's the process like for folks trying to advocate for themselves or needing to have like the legal advocacy that GHC does? Why does that, like, where are the cracks in the insurance system the trans folks fall through in terms of receiving the care that they need for to be healthy, right?
I think there's a couple things to that.
There's a couple things to that. One of the more kind of broader things of it is that healthcare is not uniform or consistent anywhere, which is problematic in ways of which there's not a set way to get the care that you need. You have to kind of just fumble and figure it out. And it also depends highly on where you live and how progressive, if you will, that state's laws are around trans people in general. Because that's going to dictate how much you can get done or what you can't even get done. Because certain states, there's just not an option for things because that state just doesn't allow it. So I would say like certain surgeries, certain document changes, Certain document changes require that you have certain surgeries depending on what state you're in, regardless of not if that surgery was even like a part of your transition or not. Like in order to, for example, one would be like, in order to change your name on your ID or on your birth certificate, you have to have been on hormones for like 2 years and I've gotten, bottom surgery or something like that. And it's like projecting this pathway of medical transition on people. And oftentimes it's more states that are kind of like in the South, in the East Coast, but it's not necessarily a set thing. And it's very, very different just state by state. So it's kind of hard to even tell anyone any specifics because it's just not uniform. And so California is one of the more progressive states when it comes to legislation around trans healthcare, but it's still not perfect because when it comes to overall like medical standards, they have different things that all providers will refer to, whether it's a nationwide thing or globally. One is called WPATH, which is specific to trans healthcare. That is kind of the more, it's not necessarily a mandatory praxis, but it's the accepted praxis for trans healthcare, which tends to be a little bit more in alignment with what trans people need, but there's still these barriers of basically having to prove yourself to this institution that you're trans in order to get healthcare, instead of just being like, I'm trans, this is what I need, you're my insurance provider, you're supposed to give me what I'm asking for, and we're supposed to go on with our lives, kind of a thing. And instead there's all these like, you have to go through this and you have to do that. And also that trans, like things that relate to kind of gender affirming care, such as surgeries or hormones and things of that nature, aren't all fully covered. Like sometimes people can get their hormones fully covered, but a lot of people have co-pays. And then certain surgeries or medical interventions may not be considered medically necessary because of the societal view on trans people. And so for a trans person, maybe them getting bottom surgery or top surgery for their transition and for their gender presentation, that actually is medically necessary for that trans person. And we do have the science to prove that once trans people are able to present and be and kind of the body and the presentation and just the experience that they want to be in, that their mental health skyrockets in a positive way. And it does the opposite when they're denied that service. And so another struggle is that you have to fight to prove certain things are medically necessary, and certain things aren't. And then if you can't, or you're someone that doesn't have access to insurance to begin with, for whatever reason, those surgeries, like something like top surgery, for example, which is a very common one, is going to run you at least $10,000. And so obviously if someone doesn't have access to a job, to even get employment, to even get access to insurance, they probably aren't going to have $10,000 sitting around. And so what trans people have to do in the past is either get loans or go into debt or do crowdfunding or GoFundMe or just save up for X amount of years to be able to pay for something that should have already been covered by the medical industry and institution.
I imagine there's a very clear through line between like the failures of our insurance our insurance system to holistically treat trans folks and the disproportionate rates of depression, mental, emotional health crises, and like self-harm, suicide that we see among trans folks. Yeah. Right.
And there's this pathology around being trans as well. Like people have, like, because you're trans, like, and because you're seeking services, and something has to be wrong with you. And because something has to be wrong with you, you have to see a therapist before you can get hormones or before you can get a surgery. Even if there's nothing going on in your life and your life is actually great and you're popping and you maybe not aren't even in poverty, like you're just everything is dolphins and rainbows and skittles for this person, and it doesn't matter because part of the process of this is, well, we want to, you know, evaluate you, which other people who are cisgender who may also be seeking hormones for whatever reason do not
you have to jump through that hoop of being labeled as abnormal or broken or in a lot of ways it's kind of a dehumanizing thing that you're forced to go through in order to receive the services that anybody else not anybody but cis folks can receive without having to be labeled, right?
Some people have to like play this performance.
Some people have to like play this performance. Like, well, I know nothing's wrong with me, but like, I want my hormones, so I'm just gonna agree with whatever they're saying, so I can get my shit and get out of here. And that's unfortunate when people have to get into that space to get the medical care that they need.
It reminds me
instead of just getting it.
In our community college district right now, in order for women who give birth to receive certain kinds of leave options to bond with their kids and to take care of their newborn child, they have to get medically diagnosed as disabled by their doctor and be labeled as disabled in order to receive the kind of like family leave that they deserve, right? So it's a similar kind of process whereby you have to, the system requires that you you do this performance, like you said, right? Which might not align with your experience and how you feel, how you see yourself, but in order to get the resources you need, you just kind of have to play this role that's kind of disingenuous. But so it sounds like if GHC was picked up and put in a state in the American South, the kinds of issues that y'all would be dealing with might look a lot different in terms of the challenges that folks face individually and the kinds of systemic changes you'd be pushing for, right? Yeah.
Mm-hmm.
Speaking of those right now in California, are there, and we're in an election year as we're talking right now, are there any policies or either at the governmental level or like institutional level that the GHC is pushing for really hard to challenge or to change?
We recently got one passed that we were part of supporting and advocating for, which was AB 2218. And I forget the official name of what that was, but I think it's something like trans equity in healthcare. That's pretty much what it's about. And what AB 2218 is supposed to do is it's supposed to offer access and tangible monetary funds to be directed specifically to identified transgender and queer organizations to make sure that in relationships with medical providers and help direct the care that trans folk need. So instead of us having to fight essentially from the outside, we get a little bit more access and autonomy and being like, this is what we know works for our people. And now we have more resource to make sure that things are flowing the way that they need and making sure that our voice is actually at the table and not outside. And so this gave us a little bit more leeway. I won't say that it's like the most perfect thing, but it's definitely a start in the right direction in terms of giving us more autonomy and access for the benefit
rather than
of
relying on those resources going to other organizations who might be well-meaning or sympathetic or identify as allies, but who don't have that direct knowledge of the needs of the community, right? Like allowing folks who have the knowledge and experience to be in charge of those funds. That seems to be like a really important first step, at least, right? The next step, of course, would be like, augmenting the pool of resources and then eventually changing the policies that make them so necessary, right? But
exactly.
Yeah. So we have about 15, 20 minutes left. Thank you so much for the perspective, the kind of like the 30,000 foot view of the work of GHC. But to finish up, I'm curious about you personally. Can you talk through kind of your story of coming into your role as an activist and advocate and leader? What that process looked like for you? How you came to be, I don't know, politicized, if you want to use that word, or what? I mean, I know I've had similar conversations with folks in the past who say that, like, you know, I was born political, like I had no choice, but and I can anticipate a similar response from you. But like, what was your process like to getting to where you are right now in terms of the activism and work that you do, being outspoken and trying to help people out?
That word is always funny to me, outspoken. Only because and this is just like a little tidbit because you said it, but in high school, in my senior year when we graduated, and I graduated high school in 2014. I'm young but old at the same time. We voted and for our yearbook, like who's most what, and I got most outspoken for my class. So I have been pretty outspoken since high school age. I was more of like a nerdy honors AP type kid, but also kind of outspoken. And so I would say for me, what got me more politicized was starting with my family, like my mom and my grandma. I would watch politics with them, watch CNN, watch other things, watch the History Channel with my mom a lot, and just be very aware of history and what's going on. And then when Trayvon Martin was murdered by George Zimmerman, we were around the same age. I was like a sophomore in high school. And I think Trayvon is like maybe like a year older or younger than me. I can't remember. But I remember feeling very awakened by that moment because I kind of was like in this place of like being half aware, just being a Black individual and a queer individual at that, and having that combination of how society views someone like me. But not fully feeling it as a Californian, thinking that everyone here was just so diverse and so accepting. Until I saw my peers, who were also majority POC, kind of justify his death. And it made me question why that was, and how could people who live similar lives as me and who are in similar social positions as me could justify something that happened by someone who's not a part of our community. And so I think that was kind of the seed. And then as I got into college, I started going to local protests, BLM protests specifically, and eventually joined BLM Sacramento chapter for a short time, for a couple of years, and developed a lot of my relationships through being in that organization with other community organizations, both through direct action against kind of police brutality and kind of that realm, but also diving into the more artistic realm of things like spoken word and art collectives and kind of throwing shows and whatnot, community shows with poetry and people's music and whatnot, just showcasing our talents, Sacramento talents. So having this kind of diverse palette and exposure to community is kind of how my journey has been going. And as I've gotten more, I guess, attuned to myself, I focused on a lot of different things. I think intersectionality is really important, even though it frustrates me a lot.
Yeah, because everyone at least in like the sociological academic world, is like, oh, intersectionality is the solution to everything. What happens? What like, when does intersectionality go wrong?
So I think intersectionality goes wrong for me when people can't understand the weight of marginalization, particularly when it comes to things like anti-indigeneity and anti-Blackness specifically. and how that's something that's not unique to just the nation of North America, but that's something that spreads throughout and is a global worldview, and something that is in conjunction with things like colorism, and not really understanding that just because we're acknowledging that intersectionality is important does not mean that we're suddenly at an equal standing and at an equal foot. And so people don't often move in a way that's honoring intersections. They move in a way that's simply they're graduating from saying, I don't see color. And it's like, okay, you see that I'm Black and you see that I'm trans and you see that I am someone that's in college but doesn't have a college degree. Yet in certain situations or conversations or maybe even like collaborations, this person who is supposed to be an ally or accomplice is marginalizing me either consciously or unconsciously. And also not understanding when it's time to listen and when it's time to elevate. And that oftentimes, and most of the time, it's time to elevate someone that's more marginalized than you, and it's less time for you to actually be speaking. And I think people have a hard time finding that balance, and very easily kind of fall into this. Well, there's kind of the spectrum of falling into saviorism, or they get complacent kind of with the elevation. So it's on the opposite spectrum of people kind of using their voice too much and then not using their voice enough and being like, oh, well, let me lift this Black trans person or this Black woman and she's doing this work and all I gotta do is like share a post and like I'm done kind of a thing. And it's like, no, like you're in an institution of your own. You have a whole family that may or may not have voted for Trump and things of that nature, or for policies that are marginalizing people. Like there's work to do for all of us, and that work's not actually happening in the way that it needs to happen, where it's more marginalized people who already have such a big plate of obstacles to clear off with such little resources, who are tasked with doing all the work and then having to remind people of how much work that we're doing, how little resources we have while we're doing the work on a constant basis, with people who are supposed to already understand that and who are supposed to be helping alleviate that. And that applies to kind of like everyone, because I found that there isn't any group that I've run into that I haven't had like an anti-Black experience, unfortunately, regardless of how I've treated people. And I've never been raised, and I actually haven't been raised to discriminate against anyone. And Black people typically are the most accepting, even statistically, the most accepting of other cultures and other people when it comes to kind of this kinship that may occur. And so I think for me, it's just been really frustrating, because here I am, someone that's extremely marginalized and have had a lot of trauma happen to me, and I'm still open to all kinds of people and advocating for all kinds of people, even when those people disrespect me and my humanity. And even when I am making sure that I'm doing my part in being intersectional, like I am not fluent in, but I speak enough Spanish to have a conversation and to navigate a Spanish-speaking country. I've gone to Spanish-speaking countries to do activism work. Like specifically in 2018, I went to Honduras and I was doing construction work and working with children who were orphans, who were impacted by the violence of MS-13 and just kind of the collapse of what's going on in Honduras because of what the U.S. has done to them, things of that nature. And that kind of being rated like one of the most dangerous countries to be in the world, and also being one of the most impoverished countries in the world as well, with 63% or more of their demographic being below the poverty line. And risking myself, knowing that I am not Honduran, and and still going out there and using my ability to speak English and Spanish to communicate with people and do this work, do actual heavy like construction, like not even like we have a whole bunch of machines, like we're mixing the cement from like our bodies and our hands and doing things from scratch and building foundations, stuff like that. Working the hardest my body has ever physically worked. And even getting sick while I was there. I got a fever at the end of the trip, and I still went on the hike to the rainforest. I still went, but it's just little things like that. Like I have had the privilege of education, but I feel like regardless of that, there's just so much more that can be done. And I do have a little bit more resource in terms of that I have been educated and have had support in that. But I feel like you don't really need to know a lot to just treat people fairly and to treat people equitably, and to really, put a stake in that. So a lot of my activism has been being direct and being transparent about what's going on in the world, because people like to move in a very
safe way,
passive way, and very safe way, and that's just not how my mind works. That's not how my family works. It's not how I communicate. I'm someone that prefers transparency from any person, being, institution that I'm interacting with. Like there should only be, if we're going to interact, then our interaction should be founded on trust and honesty and transparency and just being clear about what we're trying to do and what our boundaries are and what does that look like, and respecting each other as human beings, which should be the baseline for everyone. And because that's not happening, we need to do something about it and be loud about it, instead of just being like, oh, well, this sucks, and leaving it there. Like, I'd much rather be about action and say what needs to be said, regardless of what comes towards me. Because on one hand, when it comes to doing community work or activism or going against the system in any capacity, it does put you at risk. But when you're someone that's at the intersections of being Black and being queer and being trans, and also simultaneously acknowledging that most people who may interact with me will also view me as a Black man, despite me not being a man. And regardless of that, having those projections and implications affect me too. And having to kind of navigate that and walk with that and just say what needs to be said, because I myself represent so many communities, and there are communities that I'm connected to that I'm not a part of, that I also fight for, that I feel like we all should be doing something, because if everyone's speaking out against it, then that's half the work right there. But we can't even get to that point if people are kind of silent or complicit with the way things are now, or the way things have been.
So much of what you just talked about speaks to the challenges that that these, like nonprofit organizations or activist groups, folks who are doing this like social problems work that we talk about in our class, that they face, right? Because it's not just simply about getting resources to launch a campaign and to change a policy, right? At the end of the day, these organizations are people, right? And the amount of work that has to get done internally, right? Internal to the organization in terms of, personal dynamics and like getting along and like people feeling empowered to participate fully, people feeling supported by their collaborators, right? Their colleagues, designing organizations in such a way that power is shared, that transparent decisions are made, that that these organizations who are trying to change a broken system don't end up replicating the organizational structures of these broken capitalist systems, right? That you don't have like the iron fist, like executive director model thing going on, which I know we've talked in the past about other organizations. And like on the one hand, like those organizations, they move in that capitalist sphere better, and they can in some ways it can be advantageous to getting certain kinds of resources, getting certain kinds of things done. But at the end of the day, what are we doing what are we doing as activists or as organizations trying to change the world if we're replicating the problems that we're trying to change, right? So yeah, I mean, what you just described speaks totally to like the challenges that folks face in changing. It's not just this simple like formula. And like I get worried in my class that we talk about the social problems process in this like formulaic simple way, right? But like when you start to consider the complexity of not just outwardly facing work, but the internal work, not just internal to the organization, but internal to yourself, right? Especially for folks who are doing, like myself, like able-bodied, cis, straight, white dudes who have college degrees, like the internal work that needs to get done on that end to push things forward, right? That's a lot of work, yo. and what ends up happening, right, is like the work tends to get done by the most marginalized folks, not just the most marginalized organizations in terms of folks who don't have the resources, but the folks within organizations who occupy multiple marginal kind of social locations, right? That the disproportionate amount of work that falls on y'all's plate, it's just like, I don't know.
It's just never ending.
Yeah, it's a vicious cycle thing, you know? And yeah, so I don't want to take up too much more of your time. I and my students are so grateful for your time and your insights. I'll plug the heck out of you when I post this video in terms of to just to form a relationship via the socials with you and to support the work of the GHC. You know, is there anything you want to say in closing?
No, I think that's about it. Thank you so much for having me. And yeah, definitely folks can reach out on socials. And I guess I could like close with just saying to learn to do self-research on people who are outside of your scope, so you can truly understand before making a judgment on kind of where people are. Because I think a lot of the times we are spoon-fed a certain way to think about anything, and that we should always want to question that just a little bit. Even anything that I've said in this video, if someone is watching and feels like they may disagree or may be curious about something, I do implore you to do your own research and to really interrogate what's there, and also any preconceptions that you may have had going into something, as well as the acknowledgement of your own privileges, even if you are a marginalized person, and how that impacts your perception on things, similar to what I was talking about. And both of you kind of were addressing too, and being straight, cis, white, having a degree and being able-bodied, and recognizing that we all have intersections and they kind of fluctuate depending on like what our privileges are. And in certain instances, I'm privileged, certain other instances I'm marginalized, and oftentimes in many instances I am both marginalized and privileged in a situation, and that's also a thing. And kind of just understanding that complexity.
I feel like that's so much of the punchline from my sociology classes is like, it's messy. and if you ever think it's not messy, you're messing up. Right? So all right, with that I will I'll hit you with the standing applause hand clap.